does perineal massage prevent perineal tearing or tearing during a natural birth or vaginal delivery? The answer is no. A study by Stockham et al. And in 2013 demonstrated that perineal massage does not help prevent first, second, or third degree tears. However, that doesn't mean that it doesn't help support the tissue. So I want to dive into exactly how you can help prevent some tearing and why I think the research doesn't support perineal massage. We're going to get into it here. Perineal tearing can wreak havoc on your postpartum experience, right? I mean, like sitting, feeding a baby, sitting and just resting with baby. It can be really uncomfortable if you have a tear. And you can be doing all the right things. You can be wearing the Tux pads and all that stuff, but still feel a tremendous amount of discomfort. And so I want to talk about what you can do to really help improve your postpartum experience and hopefully also prevent perineal tearing. Now, we know that perineal massage is not effective in helping prevent perineal tearing. And so that was done in a Cochrane review in 2013 by Beckham and Stock. And they really did show that none of the tears could be prevented. However, let's get into what exactly perineal massage is and the different ways you can do perineal massage. And also let's talk about how that's not the end all be all, and there could be ways to change the pelvic floor that can actually help really amplify your vaginal delivery, can help decrease pushing times, can help decrease tears, can help decrease the risk of C-section. So we're going to get into that, all right? So here we're going to talk about the pelvic floor. I'm going to introduce you to the pelvic floor. Here's the pelvic floor. All right, there's 3 holes within the pelvic floor. There's the anus, there's the vagina, and there's the urethra, all controlled by the pelvic floor itself. When someone's saying perineal massage, usually they're saying start massaging the first layer of your pelvic floor, and they usually say at about 36 weeks. Some people will start at 32 weeks. But what that means and what that looks like is the pelvic floor has 3 layers, so 3 layers in the pelvic floor. The first layer here, the second layer isn't shown, and then there's this third deep layer. The second layer is more of these sphincters. They're a little bit on the back side of this. There are the urethral sphincters in there, and then also some fascia. So that's the second layer. So 3 layers total. Perineal massage affects only the first layer. So perineal massage is inserting a finger and sweeping side to side inside the vagina. Now, if you're doing this yourself and you're pregnant, they oftentimes will suggest using your thumbs to help get that stretch of the first layer. What can sometimes be more effective in changing this tissue and preparing it for stretch is to actually stick a finger in and pull until you feel a burn and hold that burning or stretch until it starts to fade and just breathe into it. Again, this is extremely challenging at 36 weeks when you're fully pregnant and it's hard to reach to that area. So this might be a partner activity if you're comfortable with that. However, if you're not, that's okay too. And a pelvic expert physical therapist who is trained in the body motion birth prep protocols can be a perfect person to help you work through this tissue. So you can hold till you hit that burning spot. Hold it, let it fade. Maybe that's 90 seconds, maybe that's 2 minutes. It's a significant hold. And you're just training this tissue to find new lengths so baby has an easier time working its way through. So baby's not getting stuck, right? Or you're not having to push really hard. If the tissue knows how to go to these new range of motions, these new places, it's gonna be a lot easier to get baby through that birth canal, okay? So that's only the first layer. That is only perineal massage, right? That is the first layer massage. So again, side to side swooping or pull and hold. You can work, if this is 12 o'clock up by the clitoris and down by the anus is 6 o'clock, you can work in the directions between 3 to 9 o'clock. So over here and over here, you don't want to go right up into the urethra itself. The urethra is really fragile, so we don't want to crank into the urethra. The urethra sits in the top of the vaginal canal, and it's at different depths for different people. All right, then we have the second layer. And this is where a lot of magic can start to happen. So if you work with a pelvic expert physical therapist, or you decide to buy our birth prep program, we talk about the importance of working through all 3 layers of the pelvic floor in order to help baby come through birth canal and with ease, okay? A lot of times if our pelvic floors are tight and constricted, it can be really challenging for baby to work its way through the birth canal. So many times the babies will, you'll be semi-contracted and your pushing isn't even getting to full range of motion of your pelvic floor or anywhere near the relaxation and stretching that the baby needs in order to get through without damaging you. And so a lot of people will end up pushing 2, 3, even 4 hours. I've heard someone push 6 hours, and that is so long, right? And when we're pushing, we're not just pushing baby down through birth canal. We are pushing our organs down, our rectums, the rectum, the posterior wall, the bladder, the anterior wall, the uterus, the cervix, all the way down. That can predispose and set us up for what's called a pelvic organ prolapse. And that's where these organs can fall into the actual vaginal canal itself, creating things like pelvic pressure or just a general heaviness. It can often cause pain, can cause incontinence, so like leaking urine or leaking stool. Or just not fully emptying as well. So that may turn into having to go all the time. So we really suggest working through all 3 layers of the pelvic floor and teaching these layers to go to new lengths in order for baby to be able to slide through birth canal so you can breathe your baby out without having to push for hours and hours and hours. So that's what we specialize in here at Body Motion Physical Therapy. I'm the one that created these birth protocols. And the reason we have done this is so we can help people have vaginal deliveries with a lot less trauma to their pelvic floor. So even if they do end up tearing, their tissue has already achieved new lengths and has more blood flow. And so it's just general healthier tissue. And so it's able to stretch. And so even if it does tear during childbirth, it heals a lot quicker. If you imagine tissue that doesn't get a lot of that stretching and healing, it's more fibrotic tissue. It's a lot denser. So when it tears, it just doesn't have the blood flow and the juiciness to really truly heal quickly. So it can be a lot more painful and restricting. I kind of like to talk about this in relation to like a professional athlete. If a professional athlete tears his hamstring, they are usually back on the field within like 8 weeks. Right? And there's so much healing that can happen. If a lay person or just a person on the street falls, trips, and tears their hamstring, they might need surgery. They might not walk right for a whole year. And it's just because that hamstring isn't used to fully relaxing and fully contracting and just doesn't get a lot of work. So it's a more fibrotic, dehydrated muscle. Compared to that professional athlete who has really juicy, good blood flow muscles, and they're just thick and healthy. So if it does tear, then it just heals with much more speed, and the quality of healing is also a lot better. So it just takes a lot less time. The same thing is true with the pelvic floor when we're talking about a vaginal delivery, and that's why it's so important to work all this tissue. Now, I'm going to go against what the research says. Research suggests still to this day kegels to prepare for delivery. So kegels is a pelvic floor contraction. So this is my pelvic floor, and I'm doing a contraction here, and then you want to relax fully, and then you're contracting and relaxing. Sometimes they'll say do a 10-second hold, do that 10 times, and then do 2-second holds and do that 10 times. Well, that's creating contractions, and that's creating shortening of the muscle. The problem is, if you just blanketly tell someone to do kegels to prepare for childbirth, I guarantee they are not doing them correctly. They're probably contracting some and then getting no relaxation, then contracting more and then getting a little less relaxation. And then you're just creating this really tight situation that you're not learning to open and overstretch these muscles. So the magic for really helping amplify and improve delivery outcomes and decrease the risk of C-section in the United States, we need to work on the range of motion of our pelvic floor during pregnancy. Just because you're an athlete or super healthy, which most people going into pregnancy are, especially the first one, it doesn't mean that you're just going to be like, oh yeah, my pelvic floor is super ready for this. There's a reason why. I mean, it is also trifled. I fully understand that, like, there's issues in the hospital setting. We weren't necessarily meant to give birth in hospitals, right? Like, evolutionarily speaking, we were in fields and, in our dens at home. But from where we birth now, it's really important in like the society we live in. Most people have really tightened and short pelvic floors. So you have to be tuned in to really work into the full range of motion of your pelvic floor. And so if you live with a semi-shortened pelvic floor and it stays like this might feel like your full relaxation or you're fully relaxed, when in reality you're not fully relaxed and you couldn't get a baby out of here, but your body only can get you to this pattern. And that's where working with a pelvic expert is super important, because we can get you to that full range of motion of the pelvic floor, which then is going to allow you to coordinate your breath. That'll be another video that you'll be able to watch. So that can get you to coordinate your breath, and you can find that in the birth prep program. The online birth prep program is to coordinate your breath with your pelvic floor, so you can start helping baby descend down into the pelvis with your breath, and then you can just breathe baby out without having to push for hours and hours and hours, because there's just space now in the pelvic floor for baby to come through. Now, does this mean that you're going to have like a worse recovery postpartum? It actually is the reverse. You're going to have an even better recovery, because when these muscles are overstretched, they'll know how to exactly come back together, because they'll be juicy. They'll be like the football player. They know how to work. They have good blood flow. They can heal. But if you are pushing baby out through a really fibrotic, tight muscle that isn't used to elongating, when you stitch that puppy up and you stitch the perineum up after it tears during a vaginal delivery, it's never going to reach those lengths again. Like, it has to learn those new patterns in relaxation. But because it's so fibrotic, the healing is just going to cause the scar tissue is going to cause even more tightness in the healing process, which at 6 to 8 weeks or 3 months might not be as big of a deal. But it'll come a big deal come round 2, or it'll come a big deal around 18 months when all of a sudden you go back to the gym and you're fully incontinent, or you can't hold your pee, or you're going every few hours, or every hour. We want to be able to hold for every 3 to 4 hours. If you can't do that, then you definitely need to be working with a pelvic expert physical therapist. So I hope this video helps you realize that there's a lot more options out there to help you prep for your vaginal delivery. And yes, perineal massage can potentially help you, but it's a very, very small piece of what could actually help you. Yes, that first layer needs to be stretched. And if you can't do it yourself, a pelvic expert PT absolutely can. And we do that for people. However, it doesn't mean that's enough. We have to combine treating the entire internal pelvis and the external pelvis as well. And you can find more about that on the online birth prep program. All right, thanks for joining me. Dr. Allison Felt. Please like and subscribe. If you have questions about your upcoming birth, drop comments below. Take care.